You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by ONS members, Dr. Janet Van Cleave of New York University's Meyers College of Nursing in New York City, and Dr. Micah Skeens of Nationwide Children's Hospital in Columbus, Ohio, both of whom in May 2020 received a combined total of $100,000 in grant funding through the Johnson & Johnson Nurses Innovate QuickFire Challenge in Oncology. The challenge was designed to fund projects to develop innovative ways to improve oncology care, including prevention, early detection, treatment, and care for cancer survivors. For more information on the challenge, review the press release linked in the episode notes.
Now let's hear from Dr. Skeens, member of the Central Ohio ONS chapter, who developed a mobile application for capturing the entire symptom experience of children with cancer in an interactive and fun interface, enabling personalization, interventions, and care. Thanks for being with us today, Dr. Skeens, and congratulations.
Oh, thank you so much for having me. This is so exciting.
Can you just take a little bit of time and describe your project to us?
Absolutely. I'm sad this is a podcast because I wish you could see our little character who dances around to music, and it's just so animated for the kids, and I think really engaging. So the project was initially developed by Vicki Von Sadowski, who is a nurse scientist at our institution, and she designed it for differently abled children. But in working together, I thought this is perfect for children with cancer who we know have a hard time communicating their symptoms. And often we're asking the parents to describe their symptom experience. And the literature tells us there's such discordance between what the parents report and what the children report. So this lets them tell us in a really fun, kind of gamified way how they're feeling. It also lets them tell us how intense that symptom is, how distressing that symptom is to them, kind of where the symptom is. They can choose school, home, or the hospital, day or night. So it's really just a fun application, but gets information to the clinician that's so needed.
That sounds amazing. With the way that kids interact with video games and everything like that, I can imagine how well received it is for the kids to be able to actually do that and create their own person to tell that story, where I think kids tend to tell stories to get that information across and have it be their imaginary friend or, something like that. So what a really neat way to do that. What inspired you to create the app?
So I've been a pediatric oncology nurse for over 20 years. I'm aging myself here, Stephanie, and a nurse practitioner for about 15. And what I learned just in clinical practice is that sometimes what the parents tell us isn't what the children are experiencing. And they're often hesitant to tell us about their symptoms because they don't want to upset the parent. They're so protective of them. So it really just came from my clinical practice in a way to be able to examine the symptom experience of the kids and get a more real picture of what's happening for them so that we can provide interventions to improve their quality of life.
That's really great. Did you face any challenges or obstacles that inspired you with this application? I know that you mentioned that you saw in your practice the disparity between what the parents were saying were the symptoms that the kids were having and what the kids were saying. But did you have any other challenges while you were going through this?
Not specifically while I was going through this experience, but I think a lot of the need for this, or what inspired the need for adapting this to oncology, comes from when we're caring for these kids. And unfortunately, some are home with advanced cancer on palliative care. And we're doing our best to optimize their quality of life, minimize their symptoms, but keep them at home. And I really saw the potential for this app to allow us to do that, in that they could communicate their symptoms in a fun way that wasn't bringing to light kind of what they were experiencing, but at the same time, having the potential to provide us valuable information for those kids with advanced cancer while we're keeping them at home, but still managing their symptom experience. So I hope that as the app evolves, that we get there, because I think that is such a valuable place that we need something like this.
I can see where that would be incredibly helpful. So I have a question for you. You just mentioned how the kids are at home and you're trying really hard to keep them at home. Are they able to do this from home and not just when they come into the clinic? Is it something that, that they can do from anywhere, and then that information is then transferred to the clinician?
It's an app, so it's downloadable on I have it on my phone. My daughter plays with it because she likes the little character, but any family can have it on an iOS device. So that's nice. It kind of goes anywhere. It's just not confined to hospital iPads. We're working now as part of the QuickFire challenge on kind of how we're going to transmit that information back to the clinician, because we feel like that is such an important piece. So really working with the technology team about how can we make sure that this is then communicated in real time back to the clinician or a nurse or someone that can intervene for these kids.
Okay, that's really neat. So you just mentioned how you're working with the team to make those upgrades or, additional functionality. What has been your process for the development and things like that in the past few months?
Yeah, so Dr. Von Sadowski and the team, our research and development team here, are amazing, and they had just beautiful app designed. And so we've really focused on making it very oncology specific. So adding those symptoms that we know are specific to oncology patients, fatigue, difficulty sleeping, things that are more very specific. And then also working on that piece of how can families be able to use this at home or at a distance, because we see many kids from other states. So use this, but then also make it valuable information for the clinician. So it's not just valuable for the families, but valuable for everyone, so that we can improve their quality of life. Great.
So I have a question for you. Before you entered the QuickFire challenge, did you consider yourself an innovative nurse?
No, and I still don't. And I keep saying I'm not an innovator, but the Johnson & Johnson people keep reminding me that I am now. So I think that's just how nurses are. We don't see ourselves as innovators or as business people or as teachers, but we're all those things. And so when I talk to nursing students, I always say being a nurse is the greatest job in the world, because it's all of the jobs. You get to do all of the things just as in the role of a nurse. So
I will say that I was talking to a few other nurses who have been in the process of developing something, and I asked them that same question, and they said the same thing, that they don't consider themselves that way. But I said, I think that it's so important for us as nurses to start looking at what we do that way, because in our everyday care at the bedside and, in the clinics, if we're working with a patient and talking to them and coming up with a better way to manage their symptoms or help them in different ways, those are innovative things. And I just don't think that we take credit for how creative and innovative we actually can be.
Oh, I agree. And I think nurses are such great problem solvers, which that is innovation, right? Most of the time, you're coming up with an innovative way to solve a problem. And I think if we saw ourselves more that way, we'd probably have a lot more innovative ideas and technology out there.
What do you want oncology nurses to know about your project?
I guess I would say that when you think about ways, I think we're all driven by our passion. That is what's so unique to oncology nursing, whether adults or pediatrics. And when you use that passion to problem solve or innovate, whichever word you want to use, that you really can develop something that changes the experience for patients. And so often in oncology, we're driven by the cure, which is definitely the most important, but there are other ways that we can improve kind of the whole cancer journey for families. And nurses add such an important piece to that they shouldn't sell themselves short in what value improving different pieces of that journey also brings to the patient.
That's great. I do agree with that. And I think that, because we see so many patients and every patient is different, we do have that knowledge to gain and to pull from. And, what might have been working with one person may not be working with the other. But if we can look at maybe different ways that we've worked with, a patient, remember back to a patient 2 years ago and how they had something similar and we can pull from that. I think those are really good points that you bring out that way. Can you describe for us, a case study or a patient scenario where your app was used?
Yeah, so we have not rolled it out to our patients yet. That's happening at the first of the year. We're trying to get it, just perfect for them to experience it. But I can see a case scenario where, we have a family, many times they're on these oral medications. I know a lot of adults are taking these new oral medications as well. And it requires kind of a symptom experience reporting, and the patient lives in another state, which is not uncommon for us. But they can use the Symptom app to still do their symptom reporting, but only have to come once a month versus coming weekly to just give us that symptom experience. So I think not only will we be able to improve the quality of life and manage symptoms better, but we'll also be able to limit the trips to the hospital and just improve the overall experience.
And what perfect timing with,
I know, right?
Everything that's happening in our world. I mean, to be able to do something like that you can keep the kids at home and not have to bring them in and have extra exposure risks and, just those kinds of things where, everyone is so worried about their immunocompromised patients right now. It really couldn't come at a better time. So yeah.
Yeah, I think it just adds another layer to telehealth, right? So, and many of those telehealth visits are really the provider to the parent. And so it gives the kids a voice too.
What advice do you have for oncology nurses who might want to implement something similar?
I would say first, you need a great team. So I'm not an innovator, an app developer, any of those things, but nurses have great ideas. And so you really just have to surround yourself with a really great team that has that skill set and that can kind of lead you in the right direction. I think finding a great mentor is always very important if you're new to that role or new to research, and then just keep moving forward. So you're going to hear no, but I think driven by your passion that you should just keep moving forward.
That's great advice. Well, I want to congratulate you on this amazing recognition and, winning the QuickFire challenge. And just with what you are doing and how you're going to change the quality of life and care for the kids that you see and for many more when this gets out there for other people. Do you have any final comments for us today?
I want to really thank ONS because I know that you were a co-sponsor of this QuickFire. And I am so grateful that they chose to also recognize pediatrics, because I think ONS kind of recognizing that cancer occurs across the continuum from, unfortunately, birth to older age, and that experience is important no matter what age you are. So I just so appreciate the opportunity to apply, but then also for you to recognize a pediatric innovation as well.
Well, thank you. And thank you for the work that you are doing for all those kiddos out there that unfortunately are experiencing a cancer diagnosis. We applaud you for that. And thanks for the work you're doing.
Thank you so much for having me today.
Let's hear from Dr. Van Cleave, member of New York City's ONS chapter, who received funding to create the Electronic Patient Visit Assessment, a digital health platform for capturing patient-reported cancer treatment adverse events, enabling real-time interventions, and obtaining clinical and quality data for reimbursement. Thanks for joining me today, Dr. Van Cleave, and congratulations.
Oh, thank you very much. It's a pleasure to be here with you.
So to start us off today, I would like you to tell us what was the problem that brought you to creating this product?
So patients with cancer, especially those with head and neck cancer, undergo intense, debilitating multimodal treatment consisting of surgery, radiation, oncology, chemotherapy, and immunotherapy. And they require aggressive monitoring of symptoms, especially pain, prior, during, after therapy. First of all, is to prevent the early cessation of treatment, because completion of treatment on time is very important to prevent recurrence of the cancer and is the best treatment of the cancer. And then this also, because of the debilitating treatments, that there can be costly long-term effects.
Okay, well, when you were looking at that, then what was the solution that you came up with? Can you describe your product for us?
Yes. Well, the challenge that we were wanting to address was that the patients have difficulty in communicating symptoms. And there's several reasons why that can be, is why patients do not tell and talk with their providers about the symptoms that they experience. One is that the current methods of detection, emails, telephones, additional oncology visits, create burdens on patients as well as for the clinicians. And then also, we have found that patients may not even know what to tell their oncology clinicians, and that they may not want to communicate all that is going on because they're so focused on treatment. Treatment is their life. It's the life promising, life extending. So patients will do what they can do to get treatment and continue on their treatment to either cure the cancer or prevent recurrence or control cancer metastasis. So what we wanted to do then, the solution was to create something that was easy for patients to communicate to their clinicians. And so we developed the electronic patient visit assessment, and we have a wonderful web development team at NYU Meyers. And so we came to them and said, hey, can we put this questionnaire on a web-based platform so that patients can access it anywhere on their cell phones, at home? And they did. They put it, it's called a software as a service. It's cloud-based. And so patients have access to it anywhere where they are, as long as they have some type of touchscreen or computer system. What we did is that to start it off, is that we brought iPads to the patients and had them complete it either before their oncology visits, during chemotherapy infusions, or after their oncology visits to test the platform. And we found that patients liked it, the clinicians liked it, they wanted the information and used the information for, as what you said, real-time interventions, where sometimes they would be able to make adjustments to the patient's care even before the patients left the cancer center. So we were pleased.
What a wonderful project and product to be able to have for these patients, and to let them have the time to think about what it is and put down exactly what they are feeling and how they're interpreting their experience as far as their side effect management and things like that. What challenges or barriers does your project mitigate?
What we see is, one is that patients, like I said, may not even know what to report. We carefully developed our questionnaire. We used science and we used measurement theory and clinical informatics theory to develop the questionnaire and the platform so that the questionnaire reflects symptoms that the patients told us were important, as well as the symptoms that clinicians thought were important. And the other thing that we learned and are working on is using this tool for patients to advocate for themselves in reporting their symptoms. Patients may tell clinicians something different than what they tell an inanimate object. That harkens back to the issue when patients come to see their clinicians for treatment, that they want that treatment. And of course they want that treatment. It's life-saving and it's their path to cure or preventing progression of cancer. So what patients say face-to-face to clinicians may differ than what they say to an iPad or to their iPhone. It isn't much different, but it's enough that can change clinical management. And so it's important to bring that what the clinician knows, and it's important to bring what the patient adds and talks about to their care. And together, these are very powerful tools to help care for patients.
I can see where that would be incredibly helpful for the clinicians. And I can remember back to times where the patient has already seen the oncologist and hopefully gone over how they responded or how they felt after their last treatment. And then you get them back to the treatment room and they start talking to patient beside them or to the nurse that's hanging their chemotherapy, and they start talking about all of these other little things that, now, did you bring that up to your doctor when you had your appointment right before this? And they would say, no, I didn't think that was important. So I can see where, like you were saying, sometimes they'll say something more maybe to that inanimate object, and they might think about things a little bit differently and how much that might change what the plan is and how important that is. I want to have you walk us through the process of the development over the past few months, but I will kind of just say that in light of the past few months and how things have gone and listening to what your project is and the fact that patients can do that from anywhere, this has to be wonderful for them to be able to do this from their home. And, when we're trying to keep patients safe and not bringing them into the clinic as often as we needed to before, how wonderful to have that option to do something on your phone and then the clinician receives the information. So just walk us through the process of your development over the past few months, and if the current situation that we're all going through and living through with COVID-19 how that's even affected it some.
Yeah, that's a great question, because as probably most people know, the COVID pandemic was really felt in New York City last spring. And so the streets were desolate and we heard ambulances. So it has really impacted all that we've done. So that everybody understands, these projects take a long time. So I want to say to the listeners is know that if you have an idea to keep going, and we'll go into that probably a little bit more so, but we started working on this back in 2015. And when we recruited patients before COVID, I would be in person working and embedded myself into the NYU head and neck cancer team's clinics, and would go and explain the project to the patients and would bring the iPad to them with our long-term goal of having the patients be able to access the software, like I said, remotely at home on their computers, but we weren't quite there yet. Well, COVID has pushed us there. Our cancer center is in a small building, and the infusion center is very small because we're in the midst of Manhattan, where real estate is very expensive. So every inch of the cancer center is being used. So to maintain safety, we made the decision that we would go completely remote with our project. And so we do e-consent, which is working well, and then send the patients the link to their survey. And we're experiencing a few bumps along the way because we did this before we were probably really ready. But in the language of entrepreneurs and startup, they say to fail fast. And we're learning an awful lot about what patients who are going through debilitating cancer treatment, are they able to, what they need, what they do not need in accessing computer links and software, etc. So we've been working on that, and we're having fantastic recruitment, and we're learning a lot from the patients in accessing and answering the questionnaires on their own devices. So then the second thing that we've been working on, though, is the idea that this questionnaire, that the EPVA can be an advocate for people who may not even know what to report to their clinicians. So we are extending the EPVA to our New York City public hospital system, and we have started recruiting at Bellevue Hospital. We're learning a lot there too. One of the things is that half the patients do not speak English. So we are translating the EPVA to Spanish with the help of the National Association of Hispanic Nurses and with the help of Johnson & Johnson, the Oncology Nursing Foundation. And we anticipate having a Spanish version ready for testing then in early spring. The other thing that we're learning is that Bellevue is very well constructed, as probably some of you know. I think it was built in the 1800s. So accessing the software is starting to be through wireless connections can be a little problematic. So we're fine-tuning the platform and our wireless connections there too. And I'm also happy to announce that we were just selected for the National Science Foundation I-Corps team cohort in January, which will then allow us to do even further investigation. They call it customer discovery in who really benefits from the software and what is the commercialization potential. Who will pay for this software at cancer centers? And how can we extend this to where it benefits and improves the quality of care for all patients with cancer?
You've done an amazing job and been very busy the last few months, that's for sure. What do you want oncology nurses to know about your project?
So I think I hinted at a couple of things in my previous responses. One is that these projects are ongoing long-term, but if you have a vision, and I would bet that almost every oncology nurse has a vision, what can make care better for their patients is follow it. Follow that dream. Know that there will be lumps and bumps along the way, but if you have a passion for it, keep going, persevere. And then the other thing that I want to really convey is that nurses are problem solvers. And I think that the COVID-19 pandemic has really brought this out. Not only are we the glue that keeps the healthcare together, but we also have to solve the problems and fix things that may not have even been recognized as a problem last year. We are the hackers. We are the problem solvers, and we should embrace it and run with it because we can really improve the care, the quality of care for our patients. And so let's just do it.
Yes, I agree with you. And I think that you do bring out a lot of really good points about who we are as nurses, being problem solvers and creative. And one thing that has kind of resonated with me listening to you and some other nurses that I've had the privilege of interviewing recently is how innovative nurses really are, and that we really do need to take the time and share that and celebrate our creativity. We do it every day and don't acknowledge that, and how important it is for us to do that. What is something about patient-reported adverse events that's not often talked about, but you wish people knew more about?
So I think it's that we should learn from the patients. And that's what we tell our participants who enroll, is that we're there to learn from them. Patients are problem solvers too. In some of the first interviews that we did of the patients and talking to them about their experience during cancer treatment and their experience with long-term effects afterwards, was that they would tell me what the problem was, and then they would tell me how they solved it. It was probably a problem that we didn't even know that they were experiencing. And so we need to listen to our patients. And I really want to give credit to the patients that they are responsible for any success that we've enjoyed, because they have been a part of this project from the very beginning. And then the other thing, and I want to be sure and give a shout out, I work with an amazing head and neck cancer team at NYU, very highly talented. And the importance that they place on patient symptoms, especially the nurse practitioner team, that they are also responsible for any success that we have enjoyed, but they pay attention to what the patients say in order to provide the excellent care that they do.
Great. Do you have any recommendations on resources on this aspect of care that you can give to our listeners today?
Well, first of all, your chapter and ONS as our professional society has taught me so much. And I actually was one of the first oncology nurse practitioners in the country. At least I think I was. I started in 1995. And I remember going to an ONS conference where we had a meeting of the NPSIG, and there was 9 of us. And just think of what the NPSIG is now. And so we worked together to, develop educational materials, and then lectured at conferences to help guide then those who were oncology nurse practitioners who were starting out. And ONS has been an incredible resource for me. I also credit ONS with the success that I've enjoyed for my career. We cannot underestimate the value of our professional society and the importance that it plays, and the resources that you provide and help guide people along the way. Nurses are the ones who've really focused on symptoms from the beginning. And nurses now are really the ones who are managing the symptoms. And as a result, I did some search on it. And now, if you think back on it, when I was first an oncology nurse practitioner back in like 1996 or 97, and now I think up to 75% of oncology practices have a nurse practitioner or a PA, and how important then that nursing is into the practice of oncology, and glean everything you can from our professional society.
That's great. Thank you. And you talked about earlier how if you are a nurse and you have an idea, try it. Don't quit. Don't let anybody, tell you, no, that's not a great idea. Just keep trying. And as you said, fail fast and get up and try again. So I want to thank you for the work that you've done, the work that you continue to do for the patients, and to help oncology nurses do their work and their job and improve quality patient care. And just congratulations again on this award. And do you have any final comments for us today?
Oh, I just want to say this has been a real pleasure. And I want to thank the Oncology Nursing Society, the Oncology Nursing Foundation, Johnson & Johnson. I also want to acknowledge my other funders, because I've been very fortunate to have that people have seen this work and have recognized it, which includes the Palliative Care Research Cooperative funded by the National Institute of Nursing Research and the John A. Hartford Foundation, who provided some of the first seed money for this. And also I need to thank my institution, NYU Meyers and NYU, who have supported me through this work. So yes, fail fast, but pick yourself up.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.